All right, John.
You ready to go? Let's go ahead and get things started here. Welcome, everyone. Thank you for joining today's webinar. As you can see by the slide up on your screen, we're here to talk about lean design in healthcare, a book authored by Adam Ward that's recently been released, and one that we're excited to talk to you about today. My name is John Gallagher, and I'm a vice president at Simpler. I have been on my own lean journey as we go through this for about 20 years, the last 8 with Simpler Consulting, and we are now part of the IBM company as a couple of years ago. So we have gone from a small organization to a large organization, no doubt. We're excited to talk to you today. Adam and I, while our energy today will be focused on the healthcare space, we have experience in commercial, financial services, manufacturing, and other areas as well, where Adam has implemented this in many different places. So we're excited about that. Our goal today really is to help you identify and in some cases confirm what the significant barriers are to implementing lean design in healthcare, and also what some of the potential countermeasures might be to help you get started on that journey. It's not an easy one, no doubt, but it's something that we can touch on for sure. So just a little housekeeping to get us started here. I'll start with an agenda. We've got introduction, obviously. What I'm talking about housekeeping-wise, 2 things. One is we have everybody muted on the call right now to make it easier for Q&A, but there is a question and answer box that's available to you during the presentation that I'll be monitoring. And at the end, we'll leave plenty of time at the end for questions and answers. You'll also have the opportunity to participate in a couple of poll questions, and I'll share the results as we go through that activity. So you'll just have to click on that on your screen. I've got myself a note here to make sure I stop sharing it so it doesn't block, but you can minimize that poll block anytime it gets in the way of one of your slides as well. But I think it helps us out. And then finally, again, we touched on a couple minutes ago, Adam is monitoring a Twitter hashtag LDH webinar, one that you can use during the presentation today, during the webinar, as well as afterward, as we'll share more information over the next couple of weeks and months that will keep you informed about innovation inside of this organization. So just want to jump right in here. At Simpler, we help clients implement what we refer to as the Simpler business system. And when we talk about that, while we sometimes talk about it easily, we really talk about it in the form of every organization having 2 responsibilities. And this is something that Adam and I, as well as our previous CEO, Mark Hafer, wrote about in a chapter in the book, Innovations in Healthcare Management, that was published a few years ago, where we really talk about 2 things. One is we want you to improve your current business system, run your current business better with a business system. And secondly, and where we'll focus our energy today, is on preparing for tomorrow. Now, we know that in our teaching, improving your current business is something that needs to be done in a systematic way. You need to be able to outpace the industry. You need to be able to generate a return on investment in your continuous improvement activities. And you should be able to do that with a management system such as Lean. But there are often times where you need a continuum shift in performance. You need something greater than 20% with regards to productivity or cost reduction, service or quality, whatever those components are that you look to make a big leap over your competition, especially with a lot of different things going on in healthcare today. We believe that this process that Adam outlines in the book, Lean Design in Healthcare, is one that can help you make that quantum leap in terms of performance. Now, innovation as a word inside of healthcare is definitely overused in the industry. We are going to use a definition today, as I talk about it, as a breakthrough system approach to the regular development of new products and services for your customer. And again, so we're not talking about something to just implement one new product or service, but actually generating a system at your organization that will allow you to repeatedly develop new products and services over and over. And it's a journey. It's not something that happens in 60 or 90 days. But we talk about that overall. We know that healthcare today is in need of a dire need of innovation, whether it's moving from a fee-for-service world to a value-based payment model, whether it's one of the traditional acronyms of ACO, ACA, even triple AIM or triple AIM plus one that exists, population health. We all know that organizations are in a tough time. We don't have to read very far to know that the big retailization or Amazonification is occurring inside of healthcare as well. And how is your organization preparing for that? How are you making sure that you are delivering to your patient, to your customer, the services and products that they need when they need them? Again, we believe that we have a process we get to talk about today that'll help us there. So let's go ahead and really get started with the important part. The first thing I want to do is introduce you to the author, Adam Ward. What a great picture here. You notice even in this picture on screen there, he's participating in November, the No Shave November. I, on the other hand, would not be able to do that. It just wouldn't look good on me at all. But that's why Adam can make that work. Adam has been with Simpler for about the same amount of time. I have 8 years as well, and he's our innovation guru. He's our innovation senior consultant inside of Simpler that teaches the executive teams and innovation teams how to deploy the innovation system that he'll talk about today. Adam has also worked with clients such as Atrius Health in Boston on this journey, Northwestern Mutual and Financial Services, Lockheed Martin in terms of a space in the commercial, and the U.S. Air Force to leverage lean design to increase the ability for organizations to create new products and services, in the case specifically in healthcare, of patient care models that allow them to stay ahead in today's world. Now, not only is Adam an innovation guru, but he's also a world-class athlete, and I'll touch on this a little bit later inside of our story. But Adam is humble enough not to talk about it a lot, but he is a world-class. He has participated in the Ironman 70.3 World Championships, and it's something that not only is Adam good at working with organizations that reinvent themselves, but he's done the same personally on his personal journey as well that goes through. He's been very much a mentor to me in that space and inspiration, and I look forward to hearing from him today, and I'll touch on that a little bit later. But for now, Adam, I'm going to turn it over to you to take our folks through the next 20 minutes or so.
All right. Thanks everyone for dialing in today. And if you have a copy of my book or you read a copy of the book, in the preface, I talk about why I wrote this book and how it came into existence. My background is as a design engineer. My undergraduate was in mechanical engineering. And when I joined Simpler, our CEO asked me to apply the principles I had learned while working for a world-class engineering firm to healthcare delivery. And I pushed back severely on it. And I said, I don't think that can work. Well, he was the boss and he got his way. And we ran a series of experiments all around the United States and continued that globally, really trying to find out how do we get to systematic, repeatable innovation in that so that we can sustain it. So there is a massive need for innovation in healthcare. We know it's almost 20% of our GDP here in the United States. We can look at our quality metrics, and depending on which ones we use, the U.S. can be quite down on the rankings on a global front. We know there's significant regulatory uncertainty. Again, with the House turning over leadership just yesterday, with the vote and with the presidential changes that we've had, and then could be payment reform. There's a bunch of different areas on why we actually need to innovate within healthcare. So I am going to John's going to put up a poll here and say, just wanted to see what you guys think as far as the need for innovation. What areas really worry you the most, and why would you want to implement innovation at your organization?
Yeah, so hopefully that's popping up on your screen now, and you can choose which one. It's a multiple choice. You can choose as many that are impacting you as an organization as well. As Adam touched on clearly, I'm seeing many things come through. Regulatory uncertainty in the times that we live in the political world, no doubt about it, is something that is there. I see cost popping up there as well, Adam, that goes through. We just about, I'll leave that up there just a couple more seconds, and I'll put the results up there for everybody to see. But, there are probably others as well that I think exist. Let's go ahead, and we've got almost everybody that's participated. Let's end that. I'm going to go ahead and share the results here. You can see regulatory uncertainty and cost are ones that seem to be something that everybody is no doubt worried about, but probably all those things are an impact. So we should be aware of those things as we go through the presentation today.
Thanks for sharing that with us. And that mimics what we're hearing and seeing too. John, if you can go to the next slide. So along with, understanding that there's things that we worry about, there's every organization that we go to, we can come in and we can paint the picture and we can say, when I talk about lean design in healthcare, I talk about this fictitious CEO, Mark, and he's with his innovation team and he's standing in a room. They've assembled a wall of data and charts, and the situation looks very grim. He has his executive team in there with him, and he says, my whole career, especially lately, I've been hearing about this, but no one has been able to paint the picture as the way it's been painted on this wall right now. He said, if we don't change, we're not going to exist in the future. We're not going to be financially viable. We're not going to have the patient growth that we're looking for, and we're not going to achieve the outcomes. So those can all be very scary areas that create the reason for innovation. But then also immediately following that, it's, well, what barriers do we face? And we see a lot of barriers, and we've put some of those in the second poll here. So John, if you could put that up. And we're going to address several of these in this webinar, but if you could just vote for which ones that you hear on a regular basis in your organization for a reason why we can't do innovation. And John, I know the other category can be quite broad.
Oh yeah, well, I mean, it doesn't give us. We could probably talk about these just for a long time, but I mean, I don't think there's any doubt. Just some of the barriers that are up there. These are the ones that we hear the most when we work with organizations. But there are others. I mean, I could start whether it's the culture of the organization that goes in, whether it's frankly sometimes it's apathy. Healthcare as an industry has been one that has been allowed to perform the way it's performed for the past 30 years. And there hasn't really been that immediate need for change. So I'm going to go ahead and end the polling. You can see, one of the things, there's no systematic approach, too small thinking. Organizations that just don't think big enough. They are okay with just some small improvement, and they don't want to really go through that. So a lot of different things that could have an impact as to why it would be difficult to implement an innovation culture inside of your organization.
Well, here's the good news. The good news is when we were piecing this together and putting together the outline, we have 6 things that if we get in place, that we can get systematic innovation up and running. And we'd like to cover each of those. Obviously, we have a limited time frame here, but we'll touch on each. And if there's questions, just put them in the question box, and we'll get to those. The very first thing that we need is a reason why we're going to do it. And here we call it a rally cry. And it's very simple. We have 3 blanks. So if we use the example that I talked about with Mark, the one that's in the book, excuse me.
Bless you.
Oh my.
Where is that in the book of working through webinars on being allowed to sneeze?
You're not allowed to sneeze on during webinars or blow your nose. But no, the problem that Mark faced was that they have severe pressure coming from retail clinics, and therefore they must innovate so that they are actually survive tomorrow. Now, those 3 blanks are going to change based on every organization, based on any problem that gets presented.
And I think that's interesting. I mean, even as you walk through it, we capitalize that we must in this slide for a reason. And I think the young man yelling into the microphone really is something that, the organization, to be successful at deploying lean design, to be successful at implementing an innovation culture, really must have the burning platform to make a change. I mean, that's something that has to exist, or it becomes very difficult, and the process is slowed down even further.
With our clients, we've started every engagement with a visioning session that creates the rally cry, and because we know the power of it and we know what happens when we don't have it. So in addition to the rally cry, the next thing is the executive steering team. Now, John Maxwell, leadership guru, says everything rises and falls on leadership. John Cotter, the change management expert, says that you have to have a guiding coalition, and we've found both of those to be true as well. There's 5 roles in the book that we've called out specifically in healthcare that we feel need to be included in reviewing the innovation and in making decisions regarding what they're doing. First one is the business leader. So if you're a very large organization, you may not be able to reach the CEO. So it may be someone that's running a hospital locally, or the VISN, or the place that is regionally represented. So that could be the CEO or president or vice president. The second one would be the financial person. So maybe this is the CFO, maybe it's the top financial person in that area. And the main reason for that is if we don't get that person able to fund it, if we don't get that person to able to see that this is an investment in the future and it's not going to have immediate returns, they're going to be a thorn in the flesh all the way through.
One of the biggest barriers we face on that financial side is that a CFO who starts looking right off the bat when things go a little bit slow is, well, where's my return for this activity? So they got to be bought in. They got to be understanding of that rally cry of the need for change, no doubt.
The most powerful is when we see the CEO and the CFO together, tied at the hip, saying, yes, we're going to do this. We know it's going to be long-term and we're going to move forward. The other 3 roles that play a key part, and you don't necessarily need all 3 of these, but the more of these 3 that you get, we found to be beneficial. And that would be your top medical person, whether that's a CMO or the CNO or a combination of the 2. Because we are impacting the roles and responsibilities, the daily tasks that each of those have to do, what the doctors, the physicians, the nurses, nursing staff is going to have to do with the new care models. So they should be brought in. Also, the person who leads operations, because it's their clinic or it's their hospital or it's their ambulatory surgical center. And they need to be okay with, during the preparation phase, that the experimentation that's going on there, the fact that they have to retrain the associates on the new way, they make it a lot easier. And the fact that we are in a digital age, we are an EMR mandated industry now. We would like to have the chief information officer or the chief informatics officer as part of this executive steering team as well. In addition to the executive steering team, we need the innovation team itself. So these are the people that are actually creating the tomorrow's services for the patients. They're the ones collecting the data. They're the ones doing the feasibility, the experimentation, and then ultimately prepping it for release. The first thing is a leader for innovation. And honestly, the title we found to be irrelevant, but most clients will pick their own. So it could be product owner if you like Agile. It could be chief engineer if you like lean product development. It could be the VP of innovation. The thing is they're spending 100% of their time trying to solve issues that they see in the patient community, whether it's not being able to provide certain services, whether it's not getting the quality outcomes. You could pick any one of the axes that you want. The next would be the core team. So these are the innovators. In the manufacturing world, we'd call these the engineers, but these are the people that are actually creating what will be around tomorrow. So you can see some examples in the background of this slide of new imaging devices or way patients are taken care of, but they're the ones that are actually coming up with those. In addition to the core team, there's an extended team. The extended team is on the project between 20 and 50% of the time. The core team and the leader, 50 to 100% of the time. The extended team would be functions that you need to create the new care model that you don't have. This could be mental health, could be pharmacy. You can think of a lot of different areas where you would want to pull someone in, where you would want a role or a function pulled in that needs to have representation. Then the last is the ad hoc area, and these would be people less than 20%, and they may even be in a meeting every couple of weeks, but without their input, whether it's EMR representative or a different area, you want to have that pulled in. Those should be defined. There should be names, and there should be check boxes next to those names when they are in that or those roles and working. Next is methodology. So everything from the aha, I have this great idea, till it's available to the patient. So that methodology should cover that entire range. And there's a lot of competing methodologies out there. Design thinking has significant traction. Agile has significant traction, and with its Scrum and the way it manages projects. There's also PMO offices. There's PMP certified people. There's lean product development. There's design for Six Sigma. And what we have found in our research is we are methodology agnostic. We want to go from aha to available in the quickest time while being accurate to what the patient actually needs. So in the book, Lean Design in Healthcare, we talk about the RED framework. And RED, it's an acronym. It stands for research, exploration, and delivery. And we don't believe necessarily in a stage gate approach, but we do know that some areas do require somewhat of a stage gate methodology to go through. So the research phase is really about collecting and finding out what's going on there. So Mark, and when he stood before that wall, was all secondary research collected from the system that said, okay, here's the age of our doctors. Here's when they're going to be retiring. Here's the performance of our clinics. Here are the quality outcomes. Here are HCAP, CGCAP comments, and collecting all of that information. In addition to what are competitors doing? What are retail clinics doing? What are traditional competitors doing? And then the voice of the customer. So what is the patient actually saying? And we dive really hard into understanding the patient. And it's not people gathering in a room. It's going out and talking to them very systematically. And in the book, we give some very simple tips on how to do that, very prescriptive for those that haven't done that. The next exploration phase is really about doing feasibility, running experiments, seeing what we can do, Agile Loop. Agile Loops, just running through those and getting stuff out as soon as possible. One of the big areas that we veer away from in the RED framework, from an Agile framework, is that unlike software, we can't launch something every week or every 2 weeks, not because we couldn't actually do it, but because if we're going to tell physicians and nurses that there's a new way of doing things, we can't retrain them every 2 weeks. That's just silly. So there's a pace that organizations have changed that they can handle. Every organization is different. It may be 3 months, it may be 6 months, it may be 2 years. But that's one of the primary things that we found, is that release cycle should match what a reasonable training cycle is with organizations. And we don't want to exceed that. One of the biggest things I hate is going to my app store on my phone and seeing 88 updates. And most of the updates saying bug fixes. I don't need to gobble up bandwidth to fix a bug fix that should have been set. That should have been fixed earlier. The last area of the RED is delivery, and that's really prepping it in the least waste way for launch, so that when it is available to the patient, it's done in a manner that's going to provide the highest value right off the bat.
Ultimately, for us, that methodology, Adam, is, you probably wouldn't be surprising for those who know Simpler and those who know Lean, is it's standard work. It's a methodology in which we want to be able to repeat as well. We don't want 10 different methodologies going on through the organization, because we see that as a big barrier inside the organization as well. So we try to teach that standard work methodology that allows you to repeat this over and over again.
So in addition to the methodology, going down the list is a toolkit. One of the comments that we hear all the time, and ones that, quite frankly, that we share a lot, is, if you have a hammer, everything looks like a nail. And we want to make sure that we have more than that. A lot of the stuff in product development and innovation is around analyzing multiple options. We we like to say, have at least 3 solutions for everything that you're trying to solve, and then analyze those 3 solutions against criteria. So there should be a tool around analyzing multiple options, assessing projects, assessing customer needs. So there should be a way to do weighted, prioritized lists. We do have a tool a couple of tools in the books on how to do that, a quick one and a longer one. How to run meetings. We shouldn't be holding meetings just to run meetings. Every meeting should be making a decision. So how do you make sure that 4 weeks later that people have been held responsible, that the decisions have been communicated, and that we're moving in the direction we need to? So a basic toolkit. We don't want innovation to be a toolkit. We want the toolkit to help innovation.
But I do like Pew Matrix. That's the one. I just like to say Pew Matrix. Something that we use pretty regularly.
Then the last area is governance. So John already alluded to standard work and repeatability and making sure that we're focusing on what is important. We want to take the creative element out of the repeatable elements. So we want to focus all of our creativity on the new stuff that we're creating, the new patient needs that have been identified. And governance is not one that we want to waste time on. So how often is the executive team getting together? How often are the team members getting together? The extended team, the ad hoc team? What are they talking about when they're together? What decisions are being made? And again, it's not an information sharing session, but we want to be prescriptive about that. Now, we can update that over time, but we want to make sure that it's being run in the least waste way.
I think what's important too, just with that picture with the dry erase marker, but this governance also sits within a mission control space, if you will. We like to call it mission control or OBEA. I don't care what anybody calls it, but it's a space for everything to exist. Too often today, we want to put everything onto a computer and hide it away and come back to it and just meet via webinar just like this. But it's very important to be able to see visually. I think, even in Adam's story about Mark, that CEO, and what he was able to see on the wall is not in a way. Feels very manual, but it allows that reflection to be able to occur in looking at some of the things from a big picture standpoint.
So we've talked about the 6 different areas that we think for systematic innovation. This is based on about our 10 years of working in healthcare, plus our additional 15 years before that, doing innovation outside of the healthcare world. You can be as prescriptive as you want, or you can be less prescriptive. I think one of the biggest things, John, is when people get to a stage like this, they're kind of overwhelmed with, well, where do I start?
Yeah, I think that's a big question. It's like, where do I start? If I have those must-haves, I don't have that in an organization. I've got these barriers. Where is it that I start? And I love this picture because it's a big story for me. As I said at the start in introducing Adam, he's a world-class athlete. He's an Ironman. That didn't happen for him overnight, but he's also been a mentor to me as well. So if you relate the implementation of a system to even your own personal journey, whatever that means, for me, it was a fitness journey the past couple of years. You have so many different diets that exist today, whether it's the keto diet or Atkins. You have so many different choices of a must-have, or what do I do with my macronutrients, and how many times should I lift weights versus doing cardio, and should I do hard? It's so difficult, it feels at times, to pick the one. And I had sat down with Adam as I watched him on this journey. I said, I don't even really know where to get started here. And he says, well, as he sat with me at dinner and I ate a cheeseburger and French fries, says the first thing you got to do is just stop eating French fries. It's a very basic concept. It's a very basic concept for an organization that struggles with getting started on this journey. They have so many different projects going on, so many different priorities. How do I identify which one is the right one to start on? And so, for us, we help clients to prioritize their projects and reduce the total number of projects and, increase their bandwidth to get these things going on. We help our clients to identify what those, quote, French fries are that are keeping them from becoming more healthy. So as we kind of sum up everything that's going on, there are things that we can do. First thing, we would encourage, that stop eating French fries maybe inside that story is to have a copy of the book. I think you would enjoy to have a copy of the book. You can get that on Amazon or any kind of outlet that exists there. We've been pretty excited about what's been happening there. But the next steps for an organization, maybe an organization like yours, is to participate in a lean design and healthcare workshop. So we go with a webinar today to introduce you to some basic concepts. You read the book. What's next? The workshop allows us to work with you to really that first step in the must-have, to identify what that rally cry is for you as an organization, and help us to help you identify what the barriers are.
The workshop we found to be very powerful in convincing executive teams on moving forward with systematic innovation. Prior to the workshop, they can be very reluctant, but once running through a half-day or full-day workshop, many of them have gotten on board. In fact, I don't think we've gone through a workshop where they've said, no, we want to stop at this point. We don't want to move forward. That doesn't necessarily mean you need to use simpler, but I think having the outside eyes, having someone who understands the methodology, knowing why you need to do it, combining all of those 6 things that we listed and coming out with that is a really big deal.
No, I think that's fair, Adam. And again, the workshop, it really is, it just helps you see that picture of what that might look like. Now, if you wanted to continue to work with Adam and Simpler on that journey, we do provide those consulting services, but it allows you to take a look at what you would need to do. It allows you to really make a decision of whether or not you're ready as an organization to take that leap, because it is a quantum leap. It is bigger than just stop eating French fries and going there. Mm-hmm. It is exercise as you go through that journey, which is very important. So, these are spaces that we can provide help there. We obviously would suggest starting with the book, but that's something that hopefully those 6 steps, those barriers that we talked about today, those things are things that you recognize inside your organization, recognize as ones that you might be able to change going forward as well. So again, we had a Q&A box on the bottom. I've got a couple of questions myself that I've heard before in terms of these, Adam, that we can go with. But if you have any questions you want to place in that Q&A box, I'll start with one, Adam, that always comes up. Again, normally we don't, even on these types of calls, we don't have the CEO or the COO involved in that activity. But how can I help to get my leadership team engaged in something like innovation when I believe that it's something we can get started on? It's a question we always hear, whether it's a lean journey or an innovation journey. How can we help to get the leadership team more engaged?
Yeah, I think the first part is to be able to draft a rally cry to take to them. And it's saying, hey, we've assembled this data. We're going to present it to you and show you what we think is going to happen. And we're going to pitch a solution that we think, okay, because we think this is true, we should probably do this. That to me, I think has been one of the most powerful is for a proponent inside the organization to be very passionate about it and to take some information to them. It could be something new and novel that they haven't heard before. Like, for instance, one of the things I do at primary care clinic areas is I'll just go check the number of CVSs that have popped up in the past 5 years. And if I don't hear Minute Clinic mentioned in an executive team meeting, I'll bring it up and I'll say, do you know that there have been 38 launched in your metro area and you're a primary care organization and you haven't mentioned them as a competitor? Now, it may be, okay, they know all about them and they don't think that they're impacting them at all. I'll go interview 10 or 15 of my associates and say, how many of you use the Minute Clinic instead of our organization to have a physical done for yourself or your child or for your runny nose? And the numbers of that are almost staggeringly high. But
for your sneezes.
So I use that as a simple example, to either talk to the internal stakeholders or look and see what's going on around you, and to bring that and draft your own rally cry and take that to the executives.
Excellent. Thank you, Adam. Well, again, maybe the Q&A technology, we're not getting forward, but you have used the term agile as well. And it's something that we hear a lot of today, whether it's agile or just design thinking. We use components of those as part of our RED methodology in our research, exploration, and delivery. Why is it that one or the other, or some other methodology like that, as a standalone is not enough? Why isn't design thinking enough from your perspective and your expertise?
Yeah, I kind of throw a shot across the bow at design thinking in the book at the end, from the VP of Innovations perspective, and it's obviously my perspective as an author. I think, and one of the things that I share when I go and I speak at places is, if you want a good idea, get a bunch of smart people in the room. If you want a very good idea, run something like a design thinking workshop. If you want something that's going to obsolete what you're doing and what your competitors are doing, come up with a systematic methodology. And agile and design thinking, or even design for Six Sigma, they don't have all of those proponents to obsolete something. They are strong in certain areas, and they're significantly weak in other areas. Some of them have had areas tacked on over time because they've realized that it's not working, and they're having failure modes. Why should we reinvent the wheel? There's methodologies that work better at different phases. We're actually in the process right now of writing a position paper on how competing methodologies can unite. Our red methodology is meant to kind of start that. But we shouldn't look at methodologies as one way or another. We should look at their core strengths and use them, just like we would tell our associates. We're not going to tell someone who has a penchant for details, and someone who likes to follow instructions very rigorously, to go be the creative person who's got to come up with all of the new ideas and work in a world of that's arbitrary. It's just not going to work out for them. And so I think the same thing should be with our innovation methodologies.
Absolutely. I would agree wholeheartedly. I think, that in and of themselves as standalone tools inside of the process, both agile and design thinking can be very effective. As part of a systematic methodology, you're able to multiply the effect of a good design thinking session or good agile methodology. Because I do think that agile inside of the project management component in your mission control room or your space where you're doing the work can be very important. Just kind of the last question I have, maybe, Adam, as I pop through, and it might be like really important, is that you said in the invitation that we may have a drawing for a book. How long before we might find out about that? Like, who might win a book? Is that something we'll do after the session is over with today, and we'll get in touch with those individuals?
What would people prefer? I think I'm okay with randomly picking someone right now. We can do that and send it out, John.
Well, I think we'll do that right after the call, because since I already
right
have
after
one,
the call. Okay.
if you wanted to have an autographed copy as well, you have to let us know once we contact you. You have to, I guess, be a mentee of someone to be able to get an autographed copy. Let's see here. I may have something popped up in the chat. Somebody's looking for an autographed copy. No doubt they'd like to be chosen and get an autographed copy. So we shall see. Thanks, Troy, for that comment as we go through. Well, Adam, I think, at least for me, again, I continue to learn from you. Hopefully those who have been on the webinar today have found this to be value added. I hope that we get a chance to stay in communication with you. You'll see how to stay in touch with us on the screen here with regards to either emailing us, connecting with us on Twitter. We'd love to continue that conversation further, or on LinkedIn as well with regards to staying in touch. But we appreciate you investing the time today to participate in today's webinar. And if I don't see any other questions here in the next 5 seconds, Adam, I'll give you kind of the last word, and you can take us home.
Look, the people who are innovators have a responsibility to define tomorrow. And there's some of us who can't imagine tomorrow being the same as it is today. And I think the people that are on this call are those type of people. And we need to find that stop eating French fries and get going today. This framework will enable you and help you to be able to do that in your organization. And we've been in all types of organizations: government, military, private, for-profit, nonprofit. It works everywhere. And I would just challenge you to find your voice and push on your leaders to get that going now. And this certainly our healthcare system and ultimately the patients that are being served in it need it. So thank you for joining us.
Absolutely. Well, thank you again, everyone. Thank you, Adam, for your words of wisdom today. And I look forward to meeting with you all in the future. Signing off.